Travis.
Good morning, Captain.
How are you, sir?
I'm great.
David, welcome.
Thank you.
Thanks for coming in.
Oh, you bet.
We also have a special studio audience guest, Emily, today. She does not have a mic, but she's sitting in and
She's still part of the peanut
participating.
gallery.
That's right.
Yeah, absolutely.
There might be some random claps if we say something really witty.
Or a boo.
There won't be any claps. Yeah, I don't know what's gonna happen, but there won't be claps.
Yeah. So first, Dave, I'm going to call you Dave, I think. I got a really good buddy, David, who kind of helped me with this, the launch of this concept. And Emily's met David. And so I keep my Daves and my Davids apart. Then I won't confuse my wife when
Don't mix your Dave with David.
That'll work.
So I appreciate you coming in. I've been very active on social media trying to have conversations with people who are in centralized medicine or centralized dentistry, centralized different things, because part of the journey that I've been on is just, as we're dealing with AI, we're dealing with all this information we're being inundated with. People are really overwhelmed. And, since 2020 and the pandemic, I think trust in centralized medicine is at an all-time low. I myself can say that I don't trust it almost at all. And that's not good. And so I don't want to be here as an antitrust person. I want to be able to trust it again. And I think to do that, what you have to do is have conversations with people that have been in the middle of these institutions and understand the journey that they've been on. Never ever am I going to invite someone to come in and do some gotcha stuff or anything like that. I just want it to be a natural conversation. Hopefully, if you enjoy it this time around, and you kind of get the concept of what we're trying to get to here, you're like, yeah, that was fun. I like to do that again. I think we can get somewhere with it. Because what I've been able to do with Dr. Roy is we're on our 40th episode now, and I've literally watched him evolve. I mean, he's in his 70s now, and he's, nearly retired. Very much a centralized medicine person. Now, he's not a standard, typical person. He is kind of an anti-authoritarian person. He dropped out of the AMA in the 1980s because he didn't. They were anti-Second Amendment. I thought you might like that. But just to kind of get things started here, why don't you tell Travis and Emily a little bit about yourself and the rest of the people that are listening, and we can go from there.
Sure. So I'm Dave Ogle.
Dr. David.
Used to be. The 13th of December here marked my 1-year anniversary of being retired.
I don't think you ever lose the doctor, though.
You technically. I didn't like it when I had it, but I always looked behind me for some old guy standing there every time somebody would call me that. Yeah. But, I was so immersed in my practice for 30 years, typically like we do, we worry about our patients, we worry about the treatment, we worry how they're doing, and we got the business going on because unlike a lot of medical doctors that work in a organization that takes care of everything, we're the business guy too. When we step out of the room, we're signing the lease on the copy machine or whatever, and fortunately, I had my wife, Lynn, that came on about mid-career with me, and she was pretty amazing. As the practice grew, it got larger than that I could handle myself. So she did very well of kind of helping that, but you still worry about it. And like I say, I was so immersed in it that when I finally did retire, I thought that it was going to take a long time to kind of wind down because 24/7 I was thinking about something, whether it was the patients or whether it was business, but we had our end of the year party, as we always do, and I walked out of there and I never thought of it again until freaking Chad was looking for
freaking Chad.
I've never heard
Doc Roy uses much stronger language than freaking Chad. But
I didn't think I was going to say dangling Chad. We've been there, but so we
I'll answer all of it.
He put out a request for a retired dentist, which usually you'd never see anybody even requesting a dentist, much less a retired dentist. So
I just want you to come over on weekends and fix my teeth.
Well,
no big deal. I'll give you some bourbon.
There you go. About the same time I gave the little hands up emoji, I noticed Doug Walton was volunteering me as well, or at least throwing my name out there. So,
well, to your credit, I wouldn't have expected you to. I mean, just saying, hey, I'm retired and I'll answer a few questions, but I'm not really interested in going down any paths. I mean, I would respect that. I mean, that's even doing that. So.
Well, and my wife said, "Now, why are you doing this?" And
let me talk to you later this afternoon.
Yeah.
I said, I really don't know. And
you're trapped.
And even after our quick phone call, I started thinking. I was like, my gosh, I hadn't even thought about this stuff in a year.
Mm-hmm.
And it was.
And you said you weren't, like when you were in a practice, obviously, you said you weren't big into the research side of things. You had people that researched for you most of the time.
Well, I was a clinical dentist. Can
you explain the difference between?
I think most, probably all dentists around here, maybe with the exception of a few, are clinical dentists. I mean, we get up, and by the time we get to the office, there's a patient in the chair, there's a patient in the waiting room, and there's 5 on the phone wanting in now. Mm-hmm. And we're treating them with information that we have, information that is accepted, that's not going to get us in trouble. We can't just make things up as we go along. We have protocols that we follow. We have supplies that we use, the restoration materials, the medicines that we use in-house or prescribe. And, the research side of it was not really anything I had time to think about a lot. I just had to trust the process and use the supplies that are stamped as approved, FDA, the ADA, and so that's what I meant by that. I didn't look at everything that was out there and worry overly as to what was in it or what we were using. It's just, this is what we can use, and this is the indications for it, and that's how my day was spent.
Very cool. I think I might have cut you off. You were kind of you were talking about your wife helping with the practice and kind of how that went. And I think I inserted a distraction.
Frickin' Chad.
Inserted a distraction. See, that's what he's good at. He's good at haranguing me.
It's a full-time business, running the business, and most dentists, either worked out of one room of a house, and it's or just a small office. But as time's gone on, the business has gotten much bigger, especially as insurance has come in, and you have to run it very efficiently. And COVID squashed that by all accounts. And our office was growing. I had hired. By the time I did retire, I had 4 dentists that I had hired that were all still there that then bought me out at the end. So we had a large, one of the larger offices in the area. And like I say, I couldn't have even begun to run it without her there. So, yeah, she brought a lot of help in that regard.
Very cool. So. And so you just retired. I don't know if we said this on camera or not. You just retired within the last year.
Yeah,
is that right?
13th of December.
Okay.
So
cool. Mm-hmm. Not involved with the practice or anything like that.
Nope. I maintain the building and for this year, and that'll be sold after the turn of the year.
Okay.
So then I'll be completely
free and clear.
Free and clear.
There you go.
Yeah.
So you're so just because we've kind of had some giggles with it, the doctor title, like is that something annually to be when you're a dentist? Is that something that you have to kind of renewal? Is there like a renewal process?
No, I meant that's a degree. Okay. So I
just didn't know if there was something to make you compliant that you had to do.
No, I mean you got your licensure that comes along, just like a medical doctor, but a doctorate would be a degree, a level of education. So, technically, yes, that goes on for life. But like I say, I figured if somebody got in their car and drove to my office, they have a pretty good idea that I'm a dentist or doctor or whatever. So I didn't feel that they needed to tell me that or reassure me that all the time. So
thanks for calling me that. I didn't know. I forgot all about that.
So when you're on a plane and they're like, "Is there a doctor?" You're like, "No, I don't know what you're talking about."
Will you bump me to first class?
Should have thought about that before, buddy.
Oh, there you go.
So I have a couple questions just because, like I said, I've been on this journey with Dr. Roy, and we've talked about centralized medicine and the different mechanisms that failed us, I think, pretty strongly here in the last several years. And I just really want to kind of maybe explore how ADA and AMA are the same, and FDA touches both of them. And I'm assuming when you're talking about research and products, you're talking about pharmaceutical. So there definitely are some touching points.
Oh, yeah.
I think so.
Yeah.
Similar things happen around both. And Dr. Roy has been very outspoken against the FDA just in the general things that they've recommended. And we've talked about how, centralized medicine basically has become a revolving door at the top, from FDA to pharmaceutical to lobbyists. They kind of just they just follow each other through the door and out the door. And just generally, I don't think that's good science. And, you've got people in there with perverse incentives. Sometimes they know things, they can promote certain things. They know when a medicine's coming out or certain things coming out, and they can have some trading stuff going on. So, I mean, there's just so much stuff going on there that I think I don't want to really bore you with. Yeah. I really want to kind of just understand how if there's any real differences between the two.
Well, I mean, the ADA and the AMA technically have the same purpose, and it's supposed to be to promote and to look after their members, to make practicing nicer. Now, the AMA is a much bigger, more involved organization than the ADA. I mean, dentists have always been kind of the stepchildren to physicians.
You seem a little more decentralized just because you're not in a big hospital.
No, and that's kind of the allure of dentistry, at least it has been in the past, is it's people that might have some of the same interest of having patients, but at the same time kind of wanting to be off on your own. We're kind of a different, quirky group that exist. I remember through the years, it was always, when you applied to dental school, if at some point during the interview you didn't allude to the fact that you have a desire to be your own boss, it was a big mark downward on your how they graded you in your interview, because that's a big part of your career is being your own boss. And that was always a big allure. Now, through the years, that's changed a lot. In fact, right now, from what I understand, the students in school now, it's a very, very small percent that want to run and own their own business. Most of them want to go into an organization where they can clock in and clock out. And I think COVID was a big part of that. I mean, it was going on before COVID as well, but the business has become so complicated and it's become so expensive that most of them just, they don't want to be involved with running their own practice. In fact, a lot of dental offices now are selling out to DSO, the dental service organizations, much like you saw in medicine, 20 years ago. And how that's happening has changed a lot, because there for a while, if a organization came in and bought out the office, they'd immediately take down your sign and put up their sign, and it was a disaster. And now it's being done kind of behind the closed doors. A lot more offices are being sold, but nothing changes. The names stay on the doors, and they're trying to maintain a little bit more of the doctor-patient relationship, as opposed to, coming down saying, well, now we're a corporate office and this is how things are going to be done. Still is, just not broadcast as much. But
so obviously you're not a medical doctor, so you won't know kind of the same. Like I know paperwork for Dr. Roy when he talks about running a practice between insurance and all that stuff, and I know dental insurance is not quite the same, and I don't think as complicated. But is that how much of your practice would you say, starting in the beginning to the end? I mean, did you start getting inundated with paperwork, or was that relatively?
Oh yeah. When we started, it was a lot of fee for service. I mean, there was some insurance, but it basically was rather simple.
I need a tooth pulled. There you go.
This is the cost.
Give me the cash.
Insurance pays. This is your part, and that was pretty much all there was to it. Yeah. wasn't too long after I started, and again, that was 30 years ago, 1993, that, then it kind of started changing into some of the PPO programs, and you had to be members of the insurance. And so that changed, and it got a lot more complicated because it took a lot of the control and the discussion away from what you could have with your patient. It was just, this is the way that, this is the way that it has to happen.
Is it standard of care? Is that terminology used? It sounds like that's the same structure that.
Well, they called it standard of care. Okay. That doesn't mean that it was. Right. Standard of care was basically what you really should be doing based on, what the American Dental Association and the laws called for. Now, when insurance came in, they're looking for the cheapest route out. So, they would call it. This is the standard of care. Well, in the standard of care, it was just what they want to pay. So, that was what kind of started to cause a lot of problems. And it got more complicated as time went on.
Mm. Well, I mean, when you talk about you can see the evolution of people wanting less maintenance and overhead as far as because I don't think our schools really train kind of the free mind or the critical thinking people, the people that want to go out and do their own thing. I mean, it really does. It's more and more. I don't need to get into conspiratorial words. It seems like a herding effect, though. I mean, they want you to be compliant, listen to the authority in the room, and do your work and pay your taxes. I mean, it's a short cycle of spin there. And with the kind of the grand scheme of things, kind of what I'm looking, I've got a shirt that says decentralize everything. Mm-hmm. And so, I don't know how much you're into crypto or how much you're into other things like that. But I mean, our systems have gotten so big and, tied into the schools and tied all, the money goes all the way up. And the controls, I can see how dentistry would change over time, especially once centralized medicine got, basically Dr. Roy said at one point, he wasn't controlled by the AMA because he didn't follow them. Mm-hmm. But if he wasn't compliant, the hospitals themselves would punish him.
Oh, sure.
And so it was either way, you had a boss. Right. So he was forced to vaccinate against COVID, against his will, mm-hmm. and he had to force his employees if they wanted to stay on. Otherwise, the hospitals would not accept referrals from him. Mm-hmm. So he was literally forced.
Oh, absolutely.
Or close your practice.
Absolutely. One little thing that you might not have thought of, when you talk about authority and all, is that, dentistry is one of the last areas out there where you, the patient, have a really big choice on what you want to do. And just think about, maybe a procedure that you or a family member might have in medicine. You show up at the hospital. You're not shown a brochure book and saying, we could do this or we could do that and this costs this. You're pretty much in the system of what the hospital says. This is our standard of care. Mm-hmm. This is what you want to do.
And the doctors won't go outside of that.
No, that's just
for fear of punishment.
Absolutely. But, through the years, if you showed up at a dental office and, you had a chip on a tooth, my God, it started a discussion that almost never ended. Well, I could get in there and just smooth it off and call it done. We could try to put a little filling in there. If you want to put a filling, we could do a silver filling. We could do a white filling. We could do maybe a crown on the tooth. It went on forever. If we do a crown, do you want a gold crown? Do you want a porcelain crown? Do you want a metal base with porcelain on it, or zirconia or lithium disilicate? It went on and on and on. And, of course, they always tell you, when you want to give your patient all your options, it's like, oh my God, I'm going to spend 2 hours with every patient giving you all the option. And at the end of all that, the patient goes, you know what, let's just pull it. And that's within the standard of care. If that's what the patients want to do, right. Some dentists might not want to do it, but you say, well, okay, we got to do something. Yeah. And so there's bad with that, but there's good too, because it gives you a lot of control, but it also brings up to where you might get very, very different opinions depending on what office you went to. And, you know, that certainly caused problems when someone would come in and you could see something and you'd say, well, you know, this tooth ought to maybe have a crown on it. And that would be 100% legitimate considering what was going on. Or they could go down the street and the dentist goes, let's just smooth it off and call it a day and you're out of here for $35 and that was it. And technically that was within the standard of care and could be fine.
It's inside the standard of care, but you like from the informed consent piece, it seemed like it should have been like if you're going to have any
that's the key.
Yeah.
That's
if you were going to have any centralization,
yeah.
I would say, let's have a video anytime someone has this, a video, and it just says, here's all the different things that any dentist can basically do for you. It's really up to you to choose. Watch this and then come talk to us about what you want.
Sure.
It seems like then it would be the same every time, and you didn't have to worry about the dentist down the street stabbing you in the back and saying, David doesn't know what he's talking about down there. You could just do this.
Just that there's so many ways that things could spin off. You'd have a stack of 1,000 videos, you know, just depending on everything. So,
well, we don't stack videos anymore, Dave.
No, that's true. That's true. So
back in the day, you would have had a whole room, though.
So it came down to, and that was one of the good things about when you have a long-term client is because you have a pretty good idea when they come through the door and they've got an issue. I mean, you've dealt with them for years, and it's kind of like, okay, I kind of know how this guy thinks, and, you know, I know what he's willing to put in, you know, to his mouth and what to do. And you can sit and you can try to pull things down to a few selections there. And that's the way it's certainly usually done, especially in an office where you're seeing the same dentist all the time.
Sure.
You know, now as you're getting bigger and bigger groups, sometimes you might not know who you're seeing on a particular time.
Yeah, that's been my experience. That was definitely one of the rabbit holes I wanted to go down with you and talk about a little bit. Because talking with Dr. Roy, he is my personal doctor. He basically had a special kind of practice where, you know, he would sit down with somebody an hour and a half in the beginning and get to know their history, get to know who they are, their behaviors or whatever. So it was really, you know, he really was independent minded, and the hospital systems weren't forcing him to look at 60 patients a day. And so having that one-on-one relationship and really being able to look at you over time, rather than just saying, here's your blood work or here's your x-ray, go in and fix it. I mean, you're like you're a tool at some point, because you know, you're showed something, you know how to fix it, you go in and fix it. You look and say, are you okay? You know, he kind of like, the only time I've ever seen my dentist has been upside down, you know.
Right.
But I think, you know, I would not be happy if dentists went that way more and more. I think having that, especially now that I'm kind of hoping this conversation that we're having is kind of comparing traditional dentistry versus what I would call functional or holistic dentistry. Dr. Roy used to call, anytime I would bring any of that nonsense into the medical realm, he calls it woo doctor. And to me, I just say, Doc, it's not about what hasn't been around for 50 years. It's, you know, we are evolving. There is new technology that comes out. There's new information, new studies, new data. And, you know, if you're a practicing medical physician in a hospital and you're seeing 60 people a day, to be on front edge of all this new information that's coming out, you would have to sacrifice your family and not have any time. You're already working too many hours. And, you know, so I don't blame the doctors at all. I blame the centralized information, and unfortunately, Pharma funds the medical schools, and I'm assuming they also fund dental schools and all that stuff. So that worries me. I mean, whenever the perverse incentive is so obvious. I'm a root cause analysis guy. Like when I started doing search engine optimization, what I loved about it was I could analyze data and I can look and compare things and see trends. And I'm like, okay, well this isn't right. It's like, if you're in a business to sell drugs and not to make people healthy, or to make them where they don't need drugs, and then you're funding the doctors, I mean, it's just so blatantly obvious in your face that it shouldn't be set up like that. They should not be funding medical schools or dental schools, in my opinion.
Sure. I mean, just to be fair to the organization, I mean, the ADA compared to the AMA is really a pretty good organization. I mean, they're really there for our benefit, you know. It's a go-between a lot of times between us and some of the laws that are coming out that might pit us against the insurance companies one way or the other. The people that are involved in local and state, the local dental association and the Indiana Dental Association. I mean, they're all really pretty good as far as helping us with our practices. I mean, there's, when you look at a lot of the things that the AMA is involved in that really centralized power, we don't get into that a lot. I mean, they will usually endorse products based on research of other institutions or groups or pharma, and they'll have their ADA seal that goes in there. But but there's not a whole lot of controversy that you're going to find within the ADA.
Sure.
There might be a product you don't like, or there might be a particular movement that they endorse that, may go against the grain of how you feel. But you kind of put that aside and you kind of look at everything else and you go, okay, we're going to put everybody to sleep on this podcast if we talk about the ADA. Because, if you want to talk about funding of, Native American, reservation, that's what they do, funds for mobile dental clinics, things like that. So, I mean, that's where they spend a lot of their time.
Yeah, we could definitely, I want to cross all these bridges whenever the time comes. And
Sure.
I hope you enjoy this conversation as much as I hopefully do. And, but so I guess what makes sense to me there and what you said, how the ADA and AMA would be different, especially in their relationship with pharma, would be, obviously there's not nearly as many products that can come through your hands.
It's very small.
Yeah, it's very, very small, which is good. Especially, I'm a root cause analysis guy, and if you've got 500 different things you can sell me to fix something that I could fix by walking outside and spending more time in the sun, well, I don't need to be sold all that stuff. I just want to know how to get better. Whereas, in your mouth, it's mostly pretty much straightforward. Things haven't really evolved too much, even though I say that, but going into a dentist office today compared to going into a dentist office 30 years ago is like night and day. So
I'm getting ready to get some diamond studs put in my grill. Not really.
There's Travis. We haven't heard from Travis.
No,
yet.
I had to chime in for a second, but that's how it's evolved. I don't think 30 years ago they would have rolled in and wanted to go.
Well, and just
stones in their grills.
Just the X-ray pieces and all. I know you guys had to spend a lot of money in technology and different equipment and chairs and all that. So I mean, I don't want to negate the fact that it's not advanced, but it's just. I can see where pharma just wouldn't have as much incentive to get involved.
I mean, early on in my career, I remember a young lady came in that was a pharmaceutical rep, and she was asking me, or she was telling me about some of the physicians that she calls on and, the things that they do. And she was asking who calls on me. And I said, well, really nobody calls on me. And I think a light went off on her head as, wow, I've tapped into a whole untapped universe out here. And about a week later, she called and she goes, yeah, you guys don't really do anything we'd be interested in. I mean, one of the number one drugs that I'd prescribe was PenVK, and you could go down to Schnucks and they'd usually give you that for free if you bought a gallon of milk at the same time. So, these just weren't high cost medications that we were prescribing.
You weren't setting up a retirement fund off of your cells or anything like that?
No. Nobody really particularly made any money off of us in terms of pharmaceutical.
Sure.
There, unless you had somebody that was allergic to every antibiotic you could think of and would get stuck with an erythromycin, which was if you were allergic to penicillin, which years ago wasn't very expensive, but got very expensive as the years went on. But again, that's an outlier. I mean, for the most part, we were, helping people with radiation, getting them some, fluoride paste that they could use because that was a big problem. Or antibiotics for an infection or something for discomfort. But I mean, it's usually generic stuff. And pharmaceuticals didn't have a real big interest in us. Now, possibly if you talk to an oral surgeon or a periodontist, there might be some other, more involved medications. But for us, it was, we were the stepchildren.
The stepchildren.
Rolling around with your nitrous oxide tank or something.
Yeah, that's right. That's right.
Okay, so I laid it on the table already, kind of where I wanted to end up going on this journey with you, David and Dave. I'm even getting it wrong.
Don't mix your Daves and Davids.
The only thing that you've said at all, what I would call, I'm not going to call it controversial. Whenever you first agreed to come on here, you said, I don't want to get into a big debate, and I'm not here to debate. I'm just here to kind of go on the same journey that I went with Dr. Roy, and that is I've got a lot of questions.
Sure.
And I'm very anti-authoritarian. I don't like just being told, well, this is it, just suck it up. This is how we're doing it. When someone tells me that, I'm always like, okay, I kind of want to do everything else other than what you told me. He told me right now. And to my detriment or benefit, I mean, it's just who I am. I think it's paid off for me in a lot of ways over time. It's probably hurt me a couple of times too that I, maybe not so proud of and want to talk about. But I guess the only thing, like I said, you've talked about fluoride a little bit, and whenever you responded to me, you kind of already knew fluoride was going to be something that came up. And I'm not trying to pin you into a corner about anything. I don't want to hear your quote unquote necessarily, dyed in the wool. This is what I believe about fluoride. I'm never. All I want is just. There's a lot of information coming down the pipeline. I think there's a lot of data that we haven't been given. What I've on the journey with Dr. Roy, I'm becoming more and more definitively sure that pharma is actively working to not get us healthy, but make us sick and sicker. And the fact that fluoride is this controversial thing, it's a neurotoxin. You said it in your response to me, and I'll let you get more specific about what you know, because you had a great response. And I'm like, yeah, he knows where I'm going. At some levels, it's quote unquote safe. I've got a Dr. Jack Cruz, who I'm following very closely now. He's like, fluoride has no role in human health at all. So he is an absolutist on the other side. So somewhere in between there's truth, right? And so I've still got a young kid. I wish I would have been able to have this conversation when I had 2 young kids.
I have a 6-year-old.
But he has a 6-year-old. So we're having all kinds of vaccine conversations. We're having all this different stuff. And it's all stuff that should be talked about. It should be open air. Whether I'm not here to be right. I just want real data and facts. And I don't want pharmaceutical companies telling me what's real and what's facts.
Sure.
I feel like anything that I've heard, this is a grand overstatement. I feel like most of the things I've heard about fluoride could come from a pharmaceutical company pamphlet, and that wouldn't be bad if I trusted them at all, because I feel they make more and more money the sicker we get, and we've continued to get sicker and sicker over time. And are there good treatments? Yes. Are there good drugs? Yes. Do they save lives? Sometimes, yes, they do. I'm not negating that. I'm not a doctor. I'm not telling people what to do. I want to be able to do research. I want actual data in front of me, and I want to be able to question things. And then I want people on the pro side of it to be answering those questions, and people on the no side of it. And let's air it out. Let's open this debate. Let's have the conversation.
Throw it on the table.
So that's really this role here is like, you're a traditional dentist, retired traditional dentist. And a lot of the people in the health realm that I'm following have gotten more and more into the holistic dentistry part of it, above and beyond medicine, because if you think about it, the mouth is the first place that most things come in and out of. Germs, whatever, we're exposed here. Our nose and our mouth are the 2 pathways into our body that are the easiest to get into. And so dentistry to me, how do I say this without, it's always seemed a little bit too simple. Like all I've really heard from a dentist is, well, don't eat sweets, brush your teeth, use this toothpaste, floss, and see you next year, or see you in 6 months. Right. And the more and more I'm learning, and the reason why this is an interesting conversation to me is you hear the functional medicine dentists or the oral hygiene holistic dentists, and it's a much bigger picture that they're trying to draw about the microbiome in your mouth and how to optimize that and why that's important to everything else. I don't know how many clips I'm going to end up showing today, because I don't want to just inundate you with things and whatever. I want it to flow, and I want us to pick certain things and kind of go down those pathways. Fluoride is an important conversation, and that is way up in the, like, everyone's kind of talking about that now, including RFK. If he ends up getting the seat, it's going to be talked about, right? He wrote several books, and he doesn't say things that he can get sued for, and he said a lot of bad things about Fauci and hasn't been sued yet. But anyway, so here's my point. We're going to have more and more of this information coming out, and people are going to be confused no matter what. And thank you again for coming out and saying, I was a former dentist and I want to look at these things and evaluate what's coming down the pipeline. And if my practice was if I was starting over and I was sitting in that seat again, and this new information was coming down the pipeline, how would I respond differently? How could I know if something was right or wrong, and say, yeah, I need to talk to my patients more about this, or my dental hygienists need to have these conversations, or they need to watch a video, or I need to send them home with information. I feel like we've been undereducated, where it's easy and free to get educated on a lot of this stuff. Like, I watch gazillions of YouTube videos and on Spotify and all that, and I feel like I'm on my way to medical school. Honestly, I just have done all the research. I don't want to, but I'm married to an attorney, so people ask me legal questions all the time. I'm like, well, I did stay at a Holiday Inn last night, but so fluoride is one. You had mentioned hydroxyapatite is another kind of buzzword that's going around out there, and also xylitol. And I just recently got some non-fluoride toothpaste. We've got the old toothpaste Colgate over there. They've got some
was it
spry?
Is that
So I'm not sure if it's the best xylitol product or not. Dr. Jack probably wouldn't like it because it does have a flavor to it. So I'm assuming there's things added into it. There is definitely a clip I'm going to try to find once I quit blabbering here that it talks about a study that was done in Africa. And I'm going to probably chop it up a little bit, but kids in Africa were given xylitol. I don't know if you've heard about any buzz of this or
not. That particular study.
It was something that kind of went away and nobody really ever talked about again. So they were on it for a period of time.
In a gum form, I think, right?
What?
In a gum form.
I think it was in a gum form. Yeah. And they ended up kind of going away, and it wasn't an ongoing study, but they ended up coming back after time. And the people that were in the study that got the xylitol had much better dental health than people that didn't do it, that were outside of the study. And so you hear something like that and you're like, it's like, okay, why, if you hear something like that, does a light bulb not go off? And the ADA or whatever say, okay, we're telling people to do fluoride. Fluoride may or may not be great. If it's great, Pharma should be funding it. Somebody should be funding it. Our health department should be funding it. And I just don't think they're taking it seriously. And not only that, we're putting in water, which is a whole nother conversation, right? I'm perfectly okay myself if someone wants to take fluoride. I'm not trying to advocate to get it off the market. I'm not saying that anyone who says you should take it is a bad person or they're not doing what they think is right. No, I just want what's best information, right? Okay, so sure. I'll quit babbling there, but these are a couple products, and I'll let you. I know because you came kind of with an opinion of fluoride, because you eloquently wrote it out to me. I appreciate that. Just kind of tell us where you're at with it, because again, I want to just start laying out some information and just having conversations over it and see where you're like, I don't know if I agree with that, or I can go to my research team and see what they think about this or whatever.
Sure. So I guess my memories of fluoride was I took it as a tablet as a child. We had well water. We were on the east side of Evansville, and I had my fluoride. I can't remember for how many years that I did it, but we got it. I think it came from the pediatrician, not even the dentist then at that time. But so that would have been, later 60s, that I would have been on that. Of course, fluoride started in the water then in the 50s. Then never really thought anything about it. Maybe if I didn't have fluoride, I'd have been a brain surgeon rather than a dentist. I don't know.
Dr. Jack probably would agree with you.
Oh, yeah, who knows? But, it was just always something that we did.
That's a good one.
But, there you go. In dental school, we learned the chemistry of it a little bit more, what was actually going on in terms of ingesting it as opposed to the topical and, the benefits that we had. A lot of research, goes on at the universities, and we could, as students, we could go down into the research labs, and you could actually see what was going on with it, as in terms of demineralizing the tooth or preventing demineralization, I guess I should say. As I started practicing, the controversy of fluoride's been around, since black and white movies. And, so that's not anything new. There's been concerns about it. But, you get two sides of, information coming in, and, at some point you just got to look and say, okay, what do I see? What am I seeing happening? And, I look at the demographic of the patients that I saw. So when I started in 93, my patient base was people born in the 19 teens, 20s, 30s, 40s on up. My dad was born in 1925, and my mother was born in 1935. So, those were the generations, obviously, before fluoride. And, you look at who those people were in their generation, and they're kind of the lifestyle that's being promoted to us that we want to get back to. I mean, they ate whole foods. It was from the garden to the plate. And, even if they had office jobs, they still did a lot of manual labor. And, they were doing all the things that we're saying, we need to get back to. The dairy wasn't filled with antibiotics and steroids, and the meat was clean. And everything was great, except their teeth. I mean, you look at my dad's teeth. He actually had his teeth, but I mean, they had enough mercury in them. I could have had a side business for thermometers. I mean, they were all heavily restored. And my mother had more dental problems, but of the teeth that she had, I mean, again, they were extremely heavily restored teeth, and that was pretty common for all the people of those generations. And then something happened, something just changed, and people just, not that decay went away by any means, but it became manageable. And myself, I don't think my diet was any better or worse than anybody else or what my parents had. It's probably worse because we started eating all the processed foods in the TV dinners. But I didn't have my first cavity till I went to dental school. And of course they looked through an electron microscope for anything there just to have a chance to fill. And it was probably something that was under an orthodontic bracket that I had as a kid that, we ended up putting a filling in. But, something obviously changed. And, I'd asked my dad, did you guys have oral care? Did you have, he was like, we weren't born in the 1800s, we were industrialized, country. We had toothbrush, we had toothpaste, obviously without fluoride, and we saw a dentist, and, he actually had some pretty good care back then. Some of the fillings were original ones from the 30s and 40s even. Big, large silver fillings, but they were still there and doing fine. So you kind of just think, gosh, what changed? And I think the obvious thing was fluoride. That it obviously works, and whether you have other issues with it or not, you at least got to look at it and say, okay, there's a lot of evidence that really shows this works. And after I talked to you last week, without thinking of dentistry for a long time, I just kind of got on and clicked around, and it was amazing the number of articles that popped up that showed fluoride's found not to be as effective as they thought it was, or fluoride, and it was kind of like, okay, there's some things that are worth being on the table and talking about, and I'm all for promoting that, because like you say, I want to be healthy. I want my kids and grandkids to be healthy, and I certainly want everything on the table, but to see the number of articles that I saw this past week that, really questioned the benefit of fluoride, just kind of made me think, how serious can I take this article? Because it's just there. Yeah. It's there right there.
Well, the fact that you're curious and you're just listening to it and you're not like, I can't even listen to that. I mean, that's the thing that we're going to have to deal with. We haven't even talked about AI and large language models, but I mean, the amount of information that those things are going to be able to look at and compile and pull together, and you can basically source up or source down certain, if you don't trust this site because they've lied over time, or you don't trust this person because they haven't, their perverse incentives and they're tied to this or that industry, you can filter things out. And so I think we're going to start seeing and understanding things much faster and being able to analyze them.
Oh, that'd be great. So, you look at it, you say, okay, it obviously is working. You look at the other thing that always kind of was lurking in the background was the question of, cognitive thinking. Was it causing some issues with brain activity? And, you look at the IQs from the early 1900s, they basically went up that century, and then after the turn of the millennia, they kind of started to level off and even has dropped a little bit in the last several years. Ironically, about the time that you could say, "Hey Alexa," and "Hey Siri," and you kind of wonder, like you say, people aren't being taught to think anymore, so I would think that we would have seen a pretty big drop in the IQ department years and years ago, as opposed to, 2010, when it really started to level off a little bit with the IQ rankings. And I'm not an expert on that. That's just something that I've kind of dug up. But, those are just things that you kind of look at and you go, almost to your point that you made earlier, is that, there's got to be, or not got to be, but I would think there would be with fluorine, which we use fluoride ion, maybe it's reasonable to think that there is a proper dosage that we can get some benefit from. And
it is in food. I mean, it occurs naturally in
foods, potatoes, coffees, teas.
So, I think the thing about it is, as I'm sure we are all very uniquely different at every level. Our cellular being is completely different from her sitting there, whatever. So, like the one size fits all of anything, it always has just bothered me,
right?
Because you might eat a certain amount of food that has enough fluoride in it, and your body processes it the way it needs to, and you're perfect. And then you're drinking a lot of tap water, and it just so happens your city isn't monitoring it as closely as whatever. There's been a uptick in the levels that were allowed, and now you go from having a healthy diet of it to now being overstimulated, or having that as a kid, and it causing issues.
And that's the part from a dental advice standpoint that we really don't have a lot of information on. Is we can talk pretty good about what the dosage should be, but the question really is how much is somebody getting?
Right.
And that's the part that you don't have a lot of control or knowledge over. And, it's so not talked about. I can't even tell you that I know the test that you would take to know exactly what is, residual in somebody, just because it's not, we know how much they should be getting a day, but we don't know how much they're getting a day.
Sure.
And
that's again, as you as a practitioner, you're in, you're sitting beside the seat, you're helping people every day. You don't have time to go in these rabbit holes and do all the things all the time. You're relying on information that's coming down from above, and I think we're all taught to kind of trust that those systems are set up and structured in such a way that they would only give us the information that's best for our health. You go in assuming that.
You'd certainly hope so, and from a dental standpoint, we're not tied to fluoride. If it came out and they said, okay, this just isn't what should be in the water or in any toothpaste or anything, that's not going to cost dentists money. That's going to be a boom, So we don't have any financial ties as us dentists to fluoride. I think I even mentioned on my paper before, we've always kind of been made fun of as being the only profession that's worked this hard to put ourselves out of business. And
we appreciate that.
there you go. We failed. We're still here.
I'm trying to get my attorney wife to do the same thing. It's not working.
I don't think that's going to happen.
It's not good. Never mind. I forget that.
But, so, Matt, can I ask a quick question just from something that you just hit on? Topical versus ingesting. How big of a difference is there, do you think, as far as the residual effect on a person?
Well, as far as getting the fluoride ion into the tooth structure, it needs to be ingested, during the early age to really get it in the tooth. Now, once your, tooth is developed, being able to put a topical fluoride on certainly has some benefits, but very much so for somebody that, say, is having xerostomia, which is a dry mouth. And that's something that xylitol is actually kind of good for as well. They're good products, but they seem to be good adjunct products. To say we're going to completely eliminate fluoride and just go with the hydroxyapatite and the xylitol. I think it wouldn't be immediate. I mean, we could be 5-10 years out to really see the results. But, if you got some extra cash, put it in a DSO, the dental service organization, because, business is probably going to be booming if that's all that we're using. The other part that we get into, with products like these is compliance, is that they are good. And, I would suggest that people use, some xylitol gum, anything where you can get some hydroxyapatite. But there is a compliance factor in there as well. And, when you have a group of kids that are part of a study, that's an easier control than mom that's got 3 kids that's, trying to make sure that they're getting 6 to 10 milligrams a day for 15 minutes a day at 3 to 5 different intervals. That kind of hits the peak of where they're getting the best benefit from products like these. And not that sometimes those can't work, but I think you would see very low compliance across the population. And that's one thing that fluoride really does is it hits a lot of people in demographics that aren't going to be getting dental care. And, you take that part away and, you're going to start to see some real problems. I would think.
Yeah.
I mean, in this day and age with what's all out there in other products, you wonder, would there be enough that you're getting from foods and other sources to make a difference, or not? And, it's a, people are going to have to decide if they want to go that route or not.
Well, and I'm assuming as we continue to have more wearable and personal devices at our behest, I know like the place that I go to do red light therapy and cold plunge, they've got all these new machines that they're coming through all the time that you can basically test different levels of anything at any given moment. So I'm assuming, if you just look at how things have changed with that type of stuff, that we're going to be able to test things much more closely, I think, in the not too distant future.
And that's what I referred to, is that, I don't even know if that's out to be able to do that, to say, okay, what % of fluoride should you have in a tooth structure to meet the, minimal level where you're going to get a benefit.
Well, I mean, looking at a standard a Colgate, and how many parents really think about this, but there's a warning on it on every tube of toothpaste that has fluoride in it. Keep out of reach of children under 6 years of age. If more than used for brushing is accidentally swallowed, get medical help or contact Poison Control Center right away. So, I mean, obviously the under 6 makes sense, because does a kid under 6 really have the capacity to not swallow something that tastes like mint whenever they're brushing their? I mean, a little gulp here, a little gulp there, and
I can't see the picture on that one, but usually I can't tell if it's on a brush or not. But a lot of times what you'll see is a toothbrush, and it looks like a frosty cone of soft serve over the top. They'd love for you to go through the tube pretty fast. But I mean, even myself, I mean, when I'm putting it on my toothbrush, I mean, I just basically, I don't even squeeze any out. I just almost put the bristles up against it, just enough to get a sudsing, factor to it. Yeah. I mean, you don't have to, build a soft serve cone, out of it.
That's how they get you to buy more of it.
That's right.
And it's like any medicine. I mean, I'm sure their legal department says, hey, we need to stamp this on here. And, just as they say, don't eat the lead acid battery. But
don't spill hot coffee on your lap.
There you go.
You still get paid for doing that, though.
Don't do
until
that.
They put the sign on there.
But it is a medicine, and it's probably something that we do have to be a little careful about just leaving on a sink. Just like any other medicine that you might have that you don't want kids or pets getting a hold of.
Well, just from an informed consent, I mean, it's like, whenever a person has a child, they don't come to the dentist first and say, hey, we just had a baby. What do we need to do? And, what's the best practice? When should we start brushing?
And usually your pediatrician's pretty good.
We'll do some
with oral care.
Well, I guess, so for me, I feel like now is the time whenever all this information is coming out and all this, dissenting kind of decentralized thought is when, I'd be willing to sit in an experiment. You wouldn't have to pay me. I'll buy the toothpaste, I'll whatever, and let's look at my teeth 5-10 years down the road from now. Let's have 10,000 groups, and you keep doing it your way, the old fluoride way, and I'll do these holistic things. So I think that's what we have to have, and we don't need to wait for the FDA or the ADA or some group of doctors to just say, hey, this is a good idea, we should do this. I mean, we have the power through social media and through all these large language models to do that. I mean,
and I don't think you'd hear any big dissenting argument from any dentist that I know of.
No, I don't think so.
I think more information's the better, I think everybody'd be just fine with that.
I think you put an angle on it that I never really thought about with who. Yeah, let's say we did take it away from the water, but you're kind of looking at a population. How can I say this? There are probably a lot of people that wouldn't be able to spend the money to get these things any other way than than in the water that they drink, possibly, or won't be able to go the holistic route financially that you're talking about, Chad. And I don't know. Sorry, you posed that in a way that I never thought about. Like, if you take it away, getting people to actually do the things that would require to overcome that no longer being there.
Well, and that's I think I even mentioned on my sheet to you. I mean, for me, for my family, I said this wasn't something that I'm overly passionate about. It's not something I'll lose a lot of sleep over one way or the other. And I think part of it is because, for me, I have control over it. I mean, if I don't want the fluoride in my water, I'll put a reverse osmosis on my system, bring the water out of it. We'll get, the non-fluoridated toothpaste. We've got control on that. I'll get a prescription if I want it for the kids. But, I'm fortunate enough to be able to do that. And our family's on top of it enough to monitor that if we decide to go one route or the other. But, when you're a dental association or you're a politician and you have to start making decisions for other people, like you say, sometimes it just makes you go, okay, what do we do here? So, those are just things that have to be considered. And
definitely.
Well, there's a couple different paths here that I want to explore with you. Again, not fully today, just because we have a little bit of a time constraint. But there's several different trains of thought in the holistic side of dentistry, or oral hygiene. I mentioned a couple of the products wise: hydroxyapatite, xylitol, tongue scraping is another thing that some people do, but that's not anything.
Big in India.
Never anything I heard from a dentist that I had. So, like, again, if there is benefit to it,
mouthwash.
You
brought up mouthwash the other day about oral biomes and things.
Yeah, so I mean that's a whole nother path that I think we'll take. We're going to have to break down that video kind of similar, or a series of videos similar to what I did with Dr. Roy.
Yeah,
there's a lot of trains of thought now that basically say if you have that stuff, you need to throw it away because it kills the microbiome on the tongue. So that whole thing revolves back around to nitric oxide levels in the body, and where nitric oxide levels are affected the most in the mouth, where everything hits them first. And what this
a lot of these products will
a lot of the train of thought says basically it just messes up the gut flora, and so and there's a direct correlation to low nitric oxide levels and basically all metabolic health going down.
Sure.
And so that seems like something we just really need to dig into, and having the holistic people saying it, the woo holistics of dentistry versus this, it shouldn't be a versus. It should be doctors just wanting their patients to be healthy. And, if these people selling the products aren't doing that with that in mind, that whole put yourself out of business thing, no offense, but I mean, that's kind of what we want. We want there to be less illness. Travis talked about this. I think he brought it up a little bit in the podcast with Roy, is like, well, maybe I don't have the money to get a reverse osmosis thing and to remove the fluoride, or if I go the holistic route, that toothpaste is a lot more than Colgate, and I don't know, whatever else you said might cost money. But at the end of the day, again, so revert right back around to look at what the government and the FDA is supposed to be doing, which is looking out for public health, the health of each individual. Why wouldn't we fund things that, like, let's make those products cheaper if they really are better, because it's going to save us money from the national debt and the escalation of disease all over. So, I mean, the money thing doesn't make any sense to me. Like, it should be free to us if it's that good and it's going to save us that much money on the back end. I mean, that's just the way I see it.
Sure.
If they want us to be healthy.
And again, it's got to be shown to be at least as effective as fluoride in the dosage that, we think is the best.
Sure. And
it has to be something that compliance is going to, you can't just say, well, you're not on, you didn't get the memo, you didn't give it to your kids, sorry for your luck.
Yeah. I get it.
Sometimes you are having to, make some decisions.
So
for
what's your take on holistic dentistry as a whole? And I don't know fully. I've listened to a bunch of them now, and I got a few clips that I definitely want to share before we leave today.
I know what you mean, but I'm going to say I have no idea what you mean when you say holistic dentistry.
Okay,
because
that's good.
That is, and I guess I'm saying that just so to be sure that gets addressed in the podcast, because when somebody tells you they're a holistic dentist, that doesn't mean anything. It's just like when someone told me one time, they said, well, hey, we've really liked you, but we're going to go to a cosmetic dentist. Okay. I was like, what is that? And again, it's
branding. It's branding.
It is. People want to go to a cosmetic dentist but like I say, there's no guidelines that describe what that is. It's just somebody describing themselves.
Well, it's the thing that the lawyers they get slapped in the hand pretty hard if they, quote unquote, are a specialist in something. Oh, so right. So like you can't say I'm an expert. I'm an expert in DUI, or I'm an expert in whatever, because you're placing yourself necessarily above other people in that field, which may or may not be true.
Even though there are some that only do like body injury and that kind, like they.
Yeah, but I mean, each attorney's different. That does
right. That's what I'm saying. But they are specialists in that, right?
I think it's
because they advertise like,
they do. Oh yeah.
Like our buddy Harvey Specter, I'm not going to say his name, but our buddy Harvey, he, he's just injury only. So,
yeah. Well, and the guy that has all the billboards, the Hammer. Every time my wife drives by one of his things, they're like,
which is
that's a violation. It's a violation. It's a violation. Like they just say things that are like showing how much money they've made their clients. Which
like $2 billion
an arbitrary number.
Yeah, right.
Well, I mean, not necessarily this area, but in the United States as a whole, is if you have somebody that describes himself as a holistic dentist, like I say, that might be, this person may describe themselves in a completely different way than what this one does. Mm-hmm. For many years, the whole fluoride thing had kind of died down, and I mean, when I look back at my clients, very, very few ever refused fluoride from a health reason. Usually the only reason they refused it was if their insurance didn't cover it. Mm-hmm. More were interested in the silver fillings and the mercury. Just a handful, really. But
meaning the removal of them?
The removal of them, or to not use them.
Yeah, because there's some risks associated with taking them out. Taking them out even too.
Yeah. It's kind of like asbestos in your wall. Do you just leave it there at this point, or do you or do you take it out? But
scrape it around.
But for a long time, people that describe themselves as a holistic dentist, basically it meant, well, we do composite fillings and not silver fillings. But the whole time they might be very much into their fluoride. So like I say, it's just when you're talking to somebody or somebody says that they are holistic, you just have to kind of set the ground rules of, okay, what do you mean?
Well, I've got a couple gentlemen here I'm going to introduce to you via clip. And there's a handful of people that I'm kind of tracking right now. And again, I've got a couple different books that I'm going to read. And I've got she's a professional researcher, so she's looked into all this stuff for a very long time. So I'm listening a lot to what she says and getting some cues from her, and I hope to bring her in on some of this dialogue. But I'm going to let you kind of just listen to a couple of these different intros just to maybe it'll give you a little bit of an understanding of where they're coming from. This first one, I believe his primary focus is just on increasing nitric oxide, and he's not a practicing dentist, he's a doctor, but he's focused on nitric oxide and the importance of that in overall health. And this particular podcast is like an hour and 18 minutes long. Me and Dr. Roy went through it pretty extensively in our last conversation with him. Obviously, he's not a dentist, but he was approaching it more from the nitric oxide perspective and how it just generally helps with overall health. And so there's obviously a crossover there at some point. And I kind of feel like, for me, the functional dentistry or the holistic dentistry may be more looking at how things are associated. Like, how a dentist and a doctor maybe should get together and say, we have a patient in common. And in some instances, if you're using the digital realm, you can use that amongst hundreds of different patients. And you can look at their information and say, what do these people have in common? What are we seeing? What did this person do differently? And they turned the corner and something happened. How did their mouth look differently? Did things start to change? There's some conversations there. I feel like I don't know that they happen. I don't hear about them. I don't see them on video, but like having you and Dr. Roy here just to hash these things out back and forth, to me is like, okay, well, I think we might be able to improve some things, And
it's common sense. Unfortunately, it very, very rarely happens. I mean, we have some really good speakers that come through Evansville, and there's a particular periodontist that does a really outstanding job of bringing some good information in, and some of them had to do with airway. I mean, we are collapsing our airways as time goes on, and it's leading to the sleep apneas and the and of course that also would be deprived oxygen and some of the same issues that you have when you don't have the nitric oxide.
Nitric oxide,
So, one of the things that we did was bring somebody in to really kind of look at some of the things that we should be focusing on as a dentist, and we invited all the ENTs in the area, and none showed up. So not a lot of cross communication, unfortunately, yet at this time. Hopefully that'll change.
We could have a whole conversation about that. But I part of the reason why I asked for a retired dentist is because first of all, they're busy. If you're not retired, you're a lot busier. I don't know that how much of it is ego, how much of it might be fear, potentially offending some people on either side. Because, I do delve into some political things. We haven't talked about politics at all yet. We may or may not. I think we probably align on a few things, I know, because we have
probably a few.
We have similar practices. we enjoy doing things extracurricularly in similar fashions. But, at the end of the day, again, I just want people who are willing to step up and step out. And a smart person that's accomplished, that has a practice, closes a practice, and just willing to like, okay, well, I don't think I'm done participating yet. I think I want to maybe help move the needle in some way, shape, or form. So we could literally go through almost this whole video. We don't have time today, but like, here's what I want to do with these efforts. And let me just explain this again, because I don't think I've told you. There's going to be all kinds of videos that I'm going to bring, clips of videos that I'm going to bring. And it's not necessarily that I'm trying to change your mind or change anyone else's mind. This conversation, she asks great questions. I don't feel like I need to ask the same question that she asked, because it's whatever, so it's redundant. I don't need to repeat the same things over and over. I want to take what they're saying and either analyze it, say bullshit, or no, this is good, or we should take this and focus more on this, or let's take this and turn it into a study, or let's go to RFK and really hit this over the head. Whatever it is, I feel like we always listen to things and like it can be earth shattering and change our mind. but then where does it go? It just goes out into la la land, and we forget about it, and we move on with our lives, and we just go. So the action for me is taking smart people who get things mostly right and putting it in front of more people, put it in front of people who are skeptical, but who are willing, and they don't have perverse incentives, and they're not just trying to be the macho man in the room or whatever. They're going to break it down and really think about it, and then come back and say, I don't know if I agree with all of it, but these things make sense to me. And then get another person to do the same thing. Let's keep stacking it up. So anyway, that's part of the theory here. So we'll listen to some of these things, maybe not in any particular order this time, because again, I don't want to go down any particular rabbit hole, but I want you to just hear a couple things from him. This is from the Primal podcast. I've really kind of appreciated what she's doing.
Do you think that if we boost our nitric oxide in the body, that is a way to fix all brain disease?
I not only believe that, I know it from the science.
Uh-oh. I don't know what just happened there.
Buffering.
No, it just jumped and changed.
It jumped in time and everything.
Huh, strange. It's Google. They're probably not wanting me to share that clip. Let's try again here. I'm sorry.
We have had some storms. Did your internet go out?
Well, if I have to, I can piggyback off my cell if I need to. We've not had this happen before.
Never. We can still chat.
You can also pause it for a second if we need to. Why don't you just pause it real quick and we'll come right back.
All right, we'll come back.
It still looks like it's going to jump forward. It's on.
Believe that? I know it from the scientific literature. Yeah, Joe Biden is the poster child for nitric oxide deficiency.
Dr. Nathan Bryan.
He's an expert in nitric oxide who has spent 20 years researching how this miraculous molecule will save you from heart attacks, strokes, and Alzheimer's.
And it starts with what's in your mouth.
Of every single chronic disease, it doesn't matter if it's autoimmune disease, Alzheimer's, cardiovascular disease, diabetes, all of those result from the primary loss of the production of nitric oxide. To me, it's no wonder why Americans are the sickest people on the planet, because everything we do in a Western lifestyle, whether it's Western medicine, Western diet, drug therapy, all disrupts nitric oxide production and leads to chronic disease.
So, mouthwash, it's not good.
Antiseptic mouthwash destroys the microbiome, decreases nitric oxide production, causes high blood pressure, which is the number one risk factor for the number one killer of men and women worldwide. And it's not just antiseptic mouthwash, it's fluoride. Go look at your toothpaste now, and if it has fluoride in it, read the back label, and it says, if you swallow this, contact poison control. What? Because fluoride is a poison.
Let's talk about the 6 ways to naturally increase your nitric oxide.
So I tell people the first thing you do to restore your nitric oxide production is to eliminate the things that are causing a disruption. People who've been on PPIs and antacids for 3 to 5 years have a 40% higher incidence of heart attack, stroke, and Alzheimer's. Because if people understood and really knew what these drugs were doing to them, no one in their right mind would take them. No one.
Okay. So obviously there were some fairly significantly bombastic statements made.
Bombastic.
Yeah, I think that's the right term.
Mr. Bombastic. Sorry.
So there, and I'm telling you, this whole thing, he has a lot of that. And he cites research, he cites papers, and he's studied nothing but nitric oxide for 20 years. So he impressed me enough that I'm going to keep him in the loop of the sphere of things that I'm thinking about. The thing that I'll just join in, because I said tongue scraping. Apparently there's literature saying that tongue scraping actually lowers blood pressure. So who knows how that is instigated, but that's such an immediate response. If it's true, if my blood pressure is something and I go scrape my tongue and my blood pressure does come down, that tells you something really fast. Is it anecdotal? It's anecdotal because there's no study on it and we're not in a lab and blah, 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 blah. But it's also your body's responding to something that you've done to it. Is the film on your tongue messing with your nitric oxide? I mean, what's the things that are going on?
I mean, that would be, without knowing much about that, that would be my guess.
Assuming that it's right. You're not saying that it's right.
Not assuming that it's right. But, that's what you're doing. That's the reason that you're doing it. I mean, your tongue is like the shag carpet here. And I didn't mean to call it a shag carpet.
It's like the 70s in here.
My teenager lived here.
Shag carpet, but
Shag might be a.
But no, I mean,
upgrade.
if you have a tongue scraper and you use the thing, I mean, it's amazing the amount of gunk that you get off.
I've got one in here. I should have brought it in. It's cheap.
Sometimes it's
I got 2 of them for $6 or $7.
It's a practice. We like to think of ourselves as so up on oral hygiene here in the States and all, but it's a practice that's really big in other countries. India, I think, is the one that always sticks in my mind. That that's just a thing. Mm-hmm. And you brush your teeth and scrape your tongue. Here it's. I mean, we gave them out for a while, and it was just kind of like, okay, when the supply went out, I don't think anybody ever used them.
Sure.
But like I say, and even myself, it's one of those things that I can't say that it's a daily thing, but I've got one, and like I say, when you use it, it's amazing what you get off. And of course, there's going to be a lot of bacterial flora in the mouth. Mm-hmm. I mean, it's just you've always heard that the worst bite you can get is a human bite. Mm-hmm. And
well, see, the thing is, if you were informed properly, in my opinion, if they sent you these tongue scrapers and they said, here's all the different things that this thing can potentially do. And if you tell your patients then, like, hey, our blood pressure is super high. I'm not a medical doctor, but there's a lot of evidence saying that if you scrape your tongue every 2 days or whatever, blood pressure is lower. Mm-hmm. That's something I'm going to remember when I leave the dentist's office. I'm scraping my tongue.
Yeah, I mean, I'd have a hard time, pushing the blood pressure at this point. But I get it. If it can show because the nitric oxide brings it down. Yeah. So if we can show that the bacteria in the tongue decreases the nitric oxide. Okay, those two things go together.
Yeah, so please, anytime you feel like I'm backing you in a corner and trying to say you agree with what he just said, that is not my intent. Right. And I want everybody out there to know that. I'm just sharing stuff so you can digest it and do your own research and stuff. Yeah.
But no, it's a good thing to do.
Yeah.
It's a good thing to do. And then his comment on the mouth rinses, that's something that's starting to show up more in dental literature as far as being a nuclear bomb as opposed to surgical strikes. Mm-hmm. When you start doing the mouth rinses, it has been shown to knock off some of the flora that we really want in there. And I think I saw one, and it was one I wasn't really familiar with because, again, this was kind of starting to get at the end of my career as this stuff started taking off. But there was a rinse, Stella. I'll have to get the name for you sometime. But it was Stella something. If you Googled Stella, Stella something, it'll probably come up. But it was supposedly one that had left the flora that would maintain the nitric oxide. Mm.
And Stella Life?
That's probably it.
Well, the intriguing piece of it to me is, and it probably just because I was a kid, but I remember being fearful of germs in my mouth. Mm-hmm. And
Stella Artois? No, I'm kidding.
Yeah, I was thinking beer whenever you said it. That's where I went to. It's like, well, that's probably killing a different microbiome.
There you go. Compliance would be good.
So the germs in our mouth thing, what people have not really probably been taught properly is they're healthy. Like, we need a microbiome. We need these things in our mouths that are doing things to help nitric oxide, and our body is built to naturally do those things ourselves. And anytime you introduce an outside, whether you want to call it a toxin or any kind of exogenous thing that you take, it's having an effect on that. And so we really need to weigh those things.
And all of us have a little different flora in our own mouths, and that's why sometimes you have two kids relatively the same age, same family, same diet, same products. One has cavities every time they come in, one doesn't. Mm-hmm. As just because different flora have inoculated the mouth and taken up home there.
Sure.
And they're much more susceptible to decay than the other sibling.
So I'd like to interject something real quick, just because I already said the name of it, but Stella Life was actually in June recalled.
Was it? Okay.
Due to higher than acceptable levels of total aerobic microbial counts and Bacillus SP,
another bacterial there.
Yeah, so respectively. Okay. So anyway, I just wanted to say that since I threw the name out, I at least want to say that in June it was actually recalled.
Okay.
All of it.
Okay. It had, I meant the article that I'd seen was probably before that, and then it said
Probably, yeah.
that it had a list of different ones, and there was more of the favorable flora that was left after using it. So, but like I said, that it
Just kill a fly over there or something?
I dropped my phone on the table. Sorry.
But
That's what I was using to search.
it's a product I'm not familiar with. Like I say, it probably came along after I was done.
Well, again, so what I'm going to do, I'm going to share another short clip with you with another doctor. And I didn't think I liked him out of the gate when I watched this one. I've watched it twice now. And I think I ended up liking him more than the other guy. And like the other, the people that are working with me and researching and stuff, she's got her own favorite people, and the people she talks to have their own favorite people. So we're just trying to kind of come together with what everyone kind of agrees with. Before we move on, I want to come back to something that you said, and it would be completely anecdotal. But you said that your father had a lot of mercury in his mouth, so he obviously had a lot of cavities. Do you have any knowledge of his father or his parents? And like, was there a change at some point that was noticeable? Like, did their parents, did they have bad teeth? I mean, I don't.
Well, I knew they weren't great because I remember my grandfather had partials, which meant he would have lost, numbers of teeth, not full dentures, but partials. But
so pure diet. Then that would have been probably the best diet. They had the best diet. It was
that's
just
what
meat.
We're trying to get back to.
Yeah, meat and stuff that was growing in the backyard is what you ate.
And grow your meat in the backyard.
You can't you?
Well, I guess you could cow or something.
Yeah. That one didn't go where you wanted it to go.
No, I meant they had good whole food diets. And that was kind of why I brought it up, was just for the fact that, that a lot of the things in the way they lived are how we're talking about we should get back to, and particularly in the foods we eat and the chemicals that are not in them from the past that are in them now. And but they still were very susceptible to very heavy decay rates.
Sure. Yeah, so I'd be really intrigued about the different theories as to why that occurred. And I mean, if fluoride's the only thing that fixes it, again, I want to be proven wrong, or if my logic is not right, I want to.
I can't tell you that it is. It just happened at about the time that the fluoride was introduced to the water.
Yeah, so that, and then it was added to the water, and then when did it get added to the toothpaste? What was that? I
guess I really don't know, but I think it was probably, I would think, all about the same time, because I grew up with fluoridated toothpaste as well.
I didn't mean to put you on the spot there. I didn't ask you to come prepared with that, but it would be interesting to see, like I said. So if it got added to one, and then you come over the top, and then you're putting it in your mouth potentially, then I'm assuming there wasn't an attorney warning on the fluoride toothpaste when they first put it in there, so people were brushing and just would swallow it or do whatever. So like it just was not a controlled experiment in any way, shape, or form. I wouldn't think.
I don't know. My guess would be it was probably in the product of paste before it was the water, just because that would have been an easier thing to do than put it in the municipal water system.
You would have thought.
Fluoride was first added to toothpaste in the U.S. in 1914, but it was first approved by the ADA in 1956.
And then fluoridated water didn't happen until the 70s, like late 60s, early 70s is what you thought?
I was thinking 50s.
50s fluoridated water?
Let's see.
Well,
because you were on a well system. I agree. Yeah. You grew up, it sounded like we kind of grew up in the same area.
Fluoride was first added to the water in 1945.
Yeah, there you go.
All right. Okay, so I think we're kind of laying a foundation of some of the topics that we're going to hit on over time, and I'm going to introduce this guy. And what I'll do is send these videos to you, and hopefully you get time to watch. I don't want to inundate you and like you're spending time outside of here. So I can be as
I'll just send them. We'll take pictures.
I can set them up as much as possible. Like I pull clips that I feel are important and relevant. And that's what I always do with Dr. Roy. If I feel like this is something that he would be super interested in, I'll send him the whole video. Otherwise, I'll just hit him with it whenever we get here, and it'll be a 2-minute clip or something. And that saves his time. But, he's still practicing. And again, if you just come back and talk to me, I'm not going to ask you to give you homework all the time. But if I give you some and you take it and you enjoy it, then you want to do it. Okay. So I'm going to listen to this intro again. This guy, I found, I don't know if I like the intro as much, but he's very knowledgeable, and he's more of a practicing dentist, I think.
Simply using an over-the-counter mouthwash, which the profession's been recommending since the late 1800s, that literally shortens your life. By scraping the tongue, you can literally lower your blood pressure as well.
Dr. Mark Berhenna is a world-leading functional dentist who's on a mission to fix your mouth.
What's happening in your mouth is linked to Alzheimer's and heart disease, and it starts with your toothpaste.
Separating the mouth from the body has caused a lot of harm and death. If something leaks into the gum, it is automatically right away into the bloodstream. I literally watched someone get early stages of Alzheimer's within 5 years. But fluoride in the mouth literally knocks down the oral microbiome. It also knocks down the gut microbiome. Kids using fluoridated toothpaste and swallowing it, their IQs are dropping by 4 to 7 points. Inflammation of the brain. It's safer not to use toothpaste. And that's how bad Colgate and Crest and there are other products, Glaxcocaine, and I've spoken to these companies. I would rather have you floss, brush, and chew on xylitol. So bad breath literally is a sign that your oral microbiome is dysbiotic. Obviously, if you're getting cavities every few years or every 6 months, that's not normal. And a lot of people are like, oh, I'm just getting old. That expression, I'm long in the tooth. That likely is some form of chronic inflammation in your mouth. And that would be also a dysbiotic oral microbiome due to oral care products you're using, not eating the right foods.
What do you think about eating a bit of cheese or bacon or butter at the end of the meal to protect your gums and your...
Okay, so there's all kinds of different stuff, and they go down all different paths here.
Yeah, he hit a lot. He hit a lot. The part with the IQ, you start knocking 5 points off every so many years. We'd be sitting around flipping our lips at each other right now if that was fully the case.
Have you seen the movie Idiocracy? I think we're heading there. I don't know if you've seen that or not.
the way the world is, I wouldn't be surprised. But I think most of the IQ graphs you look at, it continued to rise up until 2010 or so, where it plateaued off, and now it's dropped down a little bit. Again, I'd certainly question the strength of his statement on that one. I think fluoride and neurological function is certainly on the table. Like you say, let's beat it and talk about it and see. No issues, problems there. To say that he's eliminated it from his dental practice is stretching it. Also his assertion that I'm getting cavities because I'm getting older. You talk to these people in the mobile dental clinics going into some of these areas, decay is very, very rampant in children. And, try to get your kid into a pediatric dentist these days. They're busy. And that's even with fluoride in the water. So again, his comment on the rinses, destroying the good bacteria. I think he's correct on that. I think we can all agree on that one. Again, some of the things he's pointing out, again, I think are legitimate to talk about, but he's pretty strong on his opinion.
I'm looking for. I'm working hard to find the clip that I shared about the xylitol piece, which I would assume this particular, I think it was a tribe. Do you remember what the clip I'm talking about? I don't remember if it was a tribe or whatever, but I'm assuming
something in Africa.
They didn't have fluoride in their water. I'd almost be certain about that. I wish I could just find it real quick because I feel, again,
you can keep looking. We can talk, but I agree with you.
Got a couple questions
about the IQ statement. There's so many variables like that. I think you hit the nail on the head where I think the prevalency of the digital age really kind of made people more stupid. I hate to say it that way, but like you said, just being. I remember having to look through encyclopedias, having to do long math, having to do whatever it might be, and now kids can just Google it or just plug it into calculators or whatever, and it's become more and more. I think we're being what would be the word? We're kind of relying so much on technology that I think it does kind of drop the overall average.
When you think about what IQ is testing, it's not really meant to be how smart you are. It's how much potential that you have. And when you look at the fact that we've increased from the early 1900s to the most part now, I don't think we're being born all that much smarter, but you got more people involved in school. So even though it's supposed to be a measure of potential, I think there is an element of kids through the past learning to learn and taking tests and have gotten smarter in taking
thinking.
these tests, which has brought IQ levels up to a point, which again is probably why they're tapering off, because I think we're not as critical thinkers as we have been taught in the past. But when you look at different areas, like there was the study of lowered IQs with heightened levels of fluoride, these kind of came out of India and China, a couple of them. And, the questions kind of get to be is, okay, what's the social economical prevalence of this group? What kind of resources are they having? Are you comparing these kids to kids that have more opportunities? Have they learned more in school? And what level of fluoride are we talking about? I mean, are we talking 5 milligrams, as opposed to 0.7 that we're suggesting in the water? What are the levels? And that's where some of the inconsistencies come from. And again, it's not to take it off the table. I mean, by all means, let's put it on the table and put the light on it. But, those are things that I look at when I say, okay, would you recommend taking fluoride away from the water? And I know what it looks like in the generations before, and I know the depression that goes along with it and the other inflammation, and that's the other buzzword that I mentioned in the thing that I sent you is, everybody talks about inflammation now, from cardiacs to strokes to all the other diseases that we get. They look at the root of inflammation, and in the mouth, when we're talking about the mouth being an entry level, it's not when we're swallowing, because everywhere else in the body is protected by an epithelial layer. I mean, whether we're talking the ears, the eyes, your fingernails, even when you swallow, the innards of your body are protected from the entrance to the exit. The only place that's different than that is the teeth, because the teeth basically come up through the bone, they come up through the gum, and the only thing that separates that is a cuff of gum around the tooth.
The base of the tooth, yeah.
So when there's inflammation, whether it be just from the bacteria that's in there or even decay that's sitting on a tooth, which usually happens in between the teeth because that's where it's harder for you to get to, that gum cuff loosens. So when you go into the dentist and they're annoying you by sticking that little probe in there, because it hurts.
Yeah, it does.
And when you're basically seeing how far down between the tooth and the gum can you push that probe. And once it starts to inflame, as that gum pulls away, that pocket gets deeper and deeper and deeper. And if the blue is, if this is the tooth and this is let's say the gum's up here, as you probe down, eventually you're just going to be hitting the bone. And there's nothing stopping it. You've lost that epithelial block. So when someone comes in, and this isn't rare, it's a daily basis, you can put that little probe in, I can pull back, I can stare directly at bone
like your
in
jaw.
the mouth. So when there's bacteria in there, that's what they were referring to, is it's not the bacteria you're swallowing, it's the bacteria that's just going right down in there, and you're just going right into your system. So, I think that's one of the reasons in the past why they have suggested many of the rinses that they do, just because it's impossible for you to clean that pocket. And but in doing so, you've killed off the flora. So you have to find that balance of, benefit versus doing harm on there.
It almost sounds like chemo or something, as far as, nuclear response, trying to kill everything and try to, for the betterment of yourself or whatever, or for what the situation is. But anyway.
Sure. Sometimes, I think it seems like, and again, I wasn't a surgeon by any means, but it seems like they kind of start to limit the rinses more and more, as opposed to, rinse every day suggestion to, okay, you just had gum surgery here. Let's knock down this flora for a little bit here to allow things to really heal, and then taper back off of those rinses.
So by you saying that, I was just curious. This says use twice a day after brushing your teeth. Mm-hmm. Vigorously swish.
And my
that
son,
was something that
my son would
really
use that
used.
like crazy.
Yeah.
And when I told him, he listens to podcasts with me all the time, and I queued up several clips for him on the way to school, and he looked at me. He's like, "This means I'm not doing mouthwash anymore, right?" I'm like, "Yeah, that's what that means."
I remember years ago there was one called Plax, Plax, I think, and I think some of the studies that came out of it might have even been there at IU that water beat it.
Wow.
Well, I'm definitely going to bring that African clip next time, because I think it's beyond anecdotal. It's not a study, so it's not controlled. Obviously, there could be other factors that cause this particular anomaly, but this is another clip from Dr. B, and then I think we'll wrap up. We're getting close to 2:00, and I think we've established a pretty good foundation with things we can talk about, and hopefully you agree to come back.
Yeah, sure.
All right, let's listen to this clip real quick.
Chew xylitol gum. Have your children chew xylitol gum. Getting a cavity is a multifactorial thing. It's not just one thing. So don't let any dentist shame you into thinking that this was your fault. So here is one very easy, inexpensive solution to preventing that. If mom is chewing gum for a year before the first baby tooth erupts, the reduction in the incidence of decay is phenomenal. The reduction can be up to 93%. That's almost a perfect score, just by chewing gum, just by mom chewing gum or the caregivers chewing gum. And then there's a delayed effect. In other words, once mom and kid stops chewing gum at a certain age, there is a residual effect for the following 5 years. That's 5 years after the gum chewing stopped. So it's a head start for the oral microbiome. How much xylitol should I use? The sweet spot is frequency, not amount. Strive for 5. To keep it simple, after breakfast.
All right. So just again, another clip. He's definitely referring. It was him that had that African study, and it was him that was referring.
Hey, my chosen fan.
You can cut that one off. So I'll find that, and again, that's a little bit more. And the thing about him, and the friend that does research for me says she tracks his information. He does his research, so it is based on things that he's seeing out there. He's not just making a claim of something. So.
I'm going to make a guess, and I guess I can't really, say this is fact, but the guess of why, if mom passed it on, is that a lot of times, or not a lot of times, but when babies are born, they don't have really any flora of bacteria in their mouth. Mm-hmm. So it's almost like squatter rights. There's a house, who's going to live here? And depending on whose and what condition their flora is in, is depending on whose flora the child will get. So if you have mom chewing xylitol gum or any product that's going to keep the good flora going, the most likely person to pass on to baby is going to be mom.
Sure.
Because dads aren't allowed to hold babies for a long time.
We might break them. We've been known to do that.
That's right. So that's a guess on my part. If someone is showing that clip and say, gosh, why would that be? I don't know, but I think that would probably be the reason on that. Because as far as a child chewing the gum, I think what he said was in agreement with what I said earlier, is that, you're looking for frequency of 5 times a day or so, which I think is probably true. But you got to be compliant with doing it. I mean, a lot of kids like to chew gum, so that might be easier than making them brush. But, any mom will tell you, trying to get their kids to brush and to brush enough.
Mm-hmm. It's a battle in my house with my kid.
Oh, we found it. I mean, even with my son, when he was growing up, I remember my wife made a comment that, "Gosh, Nathan is really keeping his bathroom clean these days." And I went up there and I said, "Nathan," I said, "where's your toothbrush?"
Oh, no.
I said,
the dad dentist.
Yeah. Oh, dope.
I said, "Well, when did you lose it?" "I don't know." I said, "Do you know what people come to my office for and pay me for every day is to give them advice on how to help their kids?" You know, so, you know, so there is a compliance, especially with little ones, to be sure that they're chewing enough. And so, yeah, I think as an adjunct product, I don't have any reason that I've seen to say not use it. And I think it's got some benefits.
Cool.
Good.
Do you have any additional things you want to shoot at David for today?
Not that I can. Okay. I can really think of. No.
Thank you again.
Yeah.
I'm coming away from here excited about research. That's leading right into my podcast with Dr. Roy. I had to kind of gauge where he was and what he's willing to talk about. I'll be much better at sharing videos with you in advance if you want to watch them.
Yeah, send them to me.
And I'll have some clips pulled in. That way you can respond. I know you said you have a team or some people that you can share things with, and they
I've got friends that you can bounce ideas off of.
Or you can, or whatever. Yeah, whatever.
Yeah.
I don't want to start stepping on too many toes.
No.
But so I'm just excited about the journey, and I feel like going down a similar path that I did with Dr. Roy, and then at some point potentially bringing you guys together and seeing where the overlaps of where maybe decentralizing medicine might mean that just means dentists and doctors have some things in common that maybe we need to talk about a little more.
Yeah.
You know, we need to I think we can learn some things. Maybe that's already gone on somewhere, but I watch a lot of videos and I'm looking for it and I don't see it. So I think it'd be super helpful.
Yeah.
I appreciate your time, sir.
Hey, you bet.
Looking forward to doing it again.
Very interesting. I hope I didn't leave too much rust on the floor from being out of here.
No.
Travis, Emily, thanks for coming.
Great
Thanks for your
meeting.
help.
Thanks. Take care, guys.
Hey, take care. See ya.